Hi, I'm Chris Williams, and I'm a member of the board of Solve M.E. CFS Initiative. And this is my colleague, Mary Dimmock, who also sits on our board. I became involved with this organization because I became a patient about 9 years ago. But when I found myself ill with this disease, I found that there was very little knowledge and awareness even in the medical community.
I became involved in this disease in 2010 when my son, who had just graduated from college, became ill. He was a recent grad, as I said. He graduated Phi Beta Kappa, summa cum laude. He wanted to go on to grad school, work for a while, and then go on to grad school. But he decided to take a trip through Asia, backpacking for 5 months. And he came home after that trip with an undetected or an undiagnosed pathogen, intestinal pathogen. And then in May of 2010, he woke up suddenly with this disease. He felt like he had been hit by a bus. He felt like he had never slept. And it's all gone downhill from there. One of the things that's brought me to SMCI is that I feel that they are doing a number of efforts that address the lack of funding, that address the stigma, that assertively debunk what has been said about this disease, both in terms of clinical guidelines, but also just in the general narrative, as well as things like their patient registry, which will help to identify patients. Essential for pharmaceutical companies to get involved is to understand where the patients actually are. And that's been very difficult for them and makes it very hard for them to get involved. Another piece is being able to know how to correctly define the disease is essential for the pharmaceuticals. So I think SMCI can help through their advocacy efforts and their research efforts to drive those pieces.
I think this organization, and I've been sick 9 years, and so I have seen progress made, and I give a lot of credit to SMCI because I feel like we not only are focusing on the research that needs to be done, but we're focusing on much needed advocacy on Capitol Hill and making connections in NIH and the other agencies.
There's so many patients who have been ill for a very long time. My son has already lost 8 years out of his very young life. And I know patients who have been sick since they were 12, and they're now in their early 20s, 2 brothers. And so we have patients who are just losing so much of their lives, and we really need support.
I've really made this my #1 commitment in my retirement to try to use my own knowledge of the healthcare system from my professional career, and also to devote some of my resources. And I am a big believer in monthly giving. I give monthly to this organization, and it not only is good for me, it enables me to budget how much I am giving, but it's good for the organization because they know that they can count on a steady stream of income. So that is one of the ways that I'm giving back. And because I am one of the older members of the board, I've also given some thought to my own financial planning for my estate. And I have made accommodations for the organization in my will. And so I think there are different ways that people can contribute, and even if you're only contributing a small amount on a monthly basis, it can really add up to the kind of support that we need to do the work that we are trying to do.